Okay, so you all are here to learn about our Virginia AHEC Scholars Program. And I'm definitely going to go over program details, questions. We're going to have questions. We're going to have some feedback from some current scholars that are participating in the program right now. But I did want to go over a little bit of background information, an overview, if you will, about what AHEC, what are AHECs in general. So AHECs are they stand for Area Health Education Centers, and AHECs are sponsored through a federal grant that is funded by the Health Resources and Services Administration, which is an agency of the U.S. Department of Health and Human Services. And AHEC program supports three really main overarching goals, and that is diversity, which is preparing a diverse and culturally competent primary care workforce that can address the needs of the communities we serve. Distribution's the number 2 goal, and that's improving workforce distribution throughout the nation, and here in Virginia specifically around rural and underserved populations. And then practice transformation, which is developing and maintaining a healthcare workforce that's prepared to deliver high quality care in a transforming healthcare delivery system with an emphasis on rural and underserved communities. And then as you can see, we do that through these 4 program activities. The first is the clinical training of health professional students. The second is health career awareness programs for students in grades K through 12 and pre-major college students. Those are typically known as pipeline or pathway program. And then we also do continuing education for current practicing healthcare professionals. And the 4th activity, which is what you all are here to talk about tonight, is the AHEC Scholars Program. And that's really a top initiative for the AHEC program in general, because it does hit all of these 3 goals of diversity, distribution, and practice transformation. So it's of utmost importance, and you will play a very vital role as an AHEC scholar in Virginia. So we have 8 regions in Virginia that we went through them all earlier, but we have the Blue Ridge region, the Eastern Virginia region of AHEC. We have Capital Area Health Education Center, and I should say Blue Ridge is hosted at James Madison University. Eastern Virginia is hosted at Norfolk State University. Capital AHEC is actually hosted through the Capital Area Health Network, which is a federally qualified health center. The Rappahannock AHEC is hosted through Rappahannock Community College. Northern Virginia AHEC is hosted at George Mason University. Southside is hosted through the Higher Education Center, the South sorry, it's the Southern Virginia Higher Education Center in conjunction with the Center of Nursing Excellence located in South Boston, Virginia. So and then we have the South Central that is actually hosted through PATHS, which is also a federally qualified health center, and Southwest Virginia's AHEC is hosted at the Edvia College of Osteopathic Medicine in Southwest Virginia. So that's a look at our 8 regions, which looks big, and that's a lot of different people and things going on for sure. We do have this fully developed on our website if you want to go in and look and see, like, well, I'm in this county of Virginia, which AHEC would I be, which region would I fall into? You can do that through our website. And I will say later when we talk about the different programs and how you apply, we'll talk about how you decide which region you're going to apply to be an AHEC scholar in. Okay, so the Virginia AHEC Scholar Program is a 2-year program, and within each of those years, There's an orientation that you'll attend, and then you'll also attend individual meetings with AHEC Center Director or program staff. And these orientation and the individual meetings may be virtual or in person. It will depend on which region you're working with. Students that are in the AHEC Scholars Program also complete 40 hours of didactic modules, which we'll go into more detail about. And then also 40 hours of clinical training, which may include the clinical rotations that you're doing in your program currently. You'll also attend statewide webinars and workshops, and that is, I guess, an example of that would be next week, we're going to have a workshop for our second year AHEC scholars about leveraging their experience to be able to negotiate contracts and build their resumes and talk about loan repayment programs. So that will be exciting. And then also what everyone wants to hear about the money. There are two stipend payments. The minimum is $250 per stipend payment, but it may vary depending on your location. And the didactic hours and the clinical training hours, and really the whole program really centers around the AHEC Scholar core topic areas. And so everything that we're doing is in order to prepare you to be able to work in rural and underserved areas in an interprofessional education or interprofessional setting, with behavioral health integration, connecting communities and supporting health professionals. We talk about virtual learning and telehealth. I think there's even some telehealth clinical rotations that some of the regions are doing. Social determinants of health, of course, cultural competency, practice transformation, and then just current emerging health issues that come up, such as the pandemic and COVID-19 and things like that, that maybe didn't exist a couple of years ago, but now exist and are really real in helping our communities become healthy. So the didactic modules, it sounds really scary because we say you're going to do 40 hours of didactic work and you're kind of like, what is that? And what am I going to get out of it? This is a snapshot of our learning management system that we currently use. It is hosted through George Mason University on a platform called Moodle. And each year you'll have didactic modules that you complete as a part of your AHEC Scholar experience. Right here you can see that we do modules on cultural competency and cultural humility. Interprofessional education practice has modules for year 1 and year 2. Behavioral health has modules for year 1 and year 2. Social determinants of health are also in year 1 and year 2, practice transformation, year 1 and year 2, and then caring for opiate use disorder or substance abuse disorder is also in both years, in the modules in both years of the program. So these are topics that you'll be doing a deep dive into to learn and be able to carry with you through your practice as a healthcare professional. As I said before, there are 40 hours of clinical rotations that take place each year, and you may be able to utilize some of your clinical rotations that are happening in your professional program, specifically if they're in rural and underserved areas and include primary care. Some of the other clinical rotations that other regions have also promoted and used for their AHEC scholars are things like the RAM clinic, which this one is from the Montrose, Virginia RAM clinic that took place back in September of this year. And we had many scholars out there doing rotations and having preceptors so that they could get some clinical hours. We also have a mobile health clinic through CON, which I believe you can also get your clinical rotation hours done as well. So there's a lot of different options for clinical rotations. It shouldn't be scary, but we definitely want you to explore and experience working in rural and underserved areas within primary care and being able to have that experience as a student, as an AHEC scholar, that moving forward will help transform your practice. So how do you know if you're eligible for the AHEC Scholars Program? Well, there's three things. First, you should be enrolled in a health professions degree program. The eligible health professions program are physicians, physician assistant, nurse practitioner, nurse midwives, dentists, psychologists, pharmacists, optometrists. Those will all do the modules that we had outlined earlier. And then community health workers, public health, and allied health professional students, they will complete all the same activities. Their modules will just be a little bit different and still cover the 8 core topic areas that HRSA outlines for sure. You also have to be 2 years from your program or degree completion. So some of my friends might be completing their degree in 3 years, and that's fine. You wouldn't be eligible to apply this year, but next year you could definitely apply. If you only have 1 year left, you would not be eligible unless you're doing maybe like a residency program in the area. But we can talk about that in more detail if you want to shoot us an email to set up a meeting to talk about those specifics. And then you have to commit to 2 years in the program and a one-time program follow-up a year out. I think we're also trying to keep track of individuals as they leave scholars for a year and then also up to 4 years. So we're really interested in what you're doing with the information that you obtain and the experiences you have in this program and how that kind of helps you guide you in your career moving forward. And to do that, we need to send you surveys as you complete the program and finish up. So we try to keep track of all of our individuals who are AHEC scholars. So right now I'm going to stop sharing, but I wanted to have our current AHEC scholars introduce themselves and give a little bit of information about their experience. Okay, so if capital area AHEC scholars are on, do you all want to introduce yourself? Thanks, Shreya. Yeah.
I can go first. Hi, everyone. My name is Shreya. I am in my second year as an AHEC scholar, the AHEC Scholars Program, and I am working with Capital AHEC here in Richmond. So a little background about me. I'm a fourth-year medical student here at VCU, and being a medical student very early in my medical degree career, I guess you could say, I knew that I wanted to work with underserved communities specifically. And underserved for me meant working with patients who didn't have access to healthcare or healthcare resources that you and I know to be very common for all of us when we go to the doctor. So I sought out Capital AHEC specifically and the AHEC Scholars Program specifically for that reason, because I was interested in a lot of the resources and opportunities they were learning opportunities they were allowing for students to engage in. And I think that was a huge benefit of this program. My coordinator from Capital AHEC, Miss Eileen Harris, who I think couldn't be here today. She was extremely instrumental in opening up numerous doors for me, not only with volunteering with underserved communities, but gaining learning opportunities specifically from physicians, PAs, nurse practitioner, nurses, about what it meant to specifically be a good provider for patients who are coming from underserved communities. And I think that my medical education gave me the ability to become a doctor in the future, but this program really allowed me to learn what it meant to be a good provider for patients in underserved communities. So that's been a really amazing experience for me, not only as a student, but moving forward in my professional career as well. And I've really enjoyed it. And I'm going to pass the baton on to my fellow scholar, Susie.
Thanks. That was really well said. I'm Susie. I'm also an AHEC scholar in the CAP AHEC branch. And I am also in the second year of the program. And I guess a little bit about me. I am a 6th-year MD PhD student at VCU. So it's been a long journey. But one of the things that I really appreciate about being an AHEC scholar is the opportunity to get involved with the community. And I think Shreya can also attest to this. Like, it's one of the things that's kind of missing from medical education. Like, yes, we interact with patients. Sure, there are like free clinic opportunities, but for the most part, you kind of see people in one space and that's it. Whereas with the AHEC Scholars Program, we have that ability to actually be in the community, to see people come back multiple times. Like, there's one event that I volunteer with routinely, and we do blood pressures in the main library. And I see some of the same people, every third Saturday of the month, and they come back to make sure that they get their blood pressure taken. And it's nice to have that continuity, but also to be involved in a way where I feel connected to the community that I'm learning in, instead of just being here for med school and then moving on to the next stop for me. So that's been really great. And then I think in general, the vast number of opportunities to connect with other healthcare professionals, to learn from other healthcare professionals, because this has also given me the opportunity to interact with PAs, nursing students, and other individuals that, for the most part, in my little med school PhD bubble, I don't get a chance to interact with.
That's great. Thank you so much. We also have some scholars from our Rappahannock AHEC, Kendra.
Hi guys, I'm Kendra. I'm also my second year of the AHEC as well. I am a ADN student, so a registered nurse program at Rappahannock Community College, graduating this December. And I'm not even gonna lie to you, I joined AHEC for the scholarship. To be honest with you, Miss Stacy tracked me down, and as I got to work with everyone, it was an amazing opportunity. Not just the ability to serve your community and get to know your community better, but really the connections that you make with other people in the program and meeting people. You get a lot of experience with professionalism, learning how to speak in this network of healthcare, really give you a foundation to start with before you graduate, which is so needed. We're always so worried about the academic portion of it and knowing everything, but really we're thrown to the wolves when it comes to navigating through HR. And it gives us the opportunity to actually meet with HR representatives in the hospital and get right from the mouth of babes what they're looking for, which can put you ahead in lots of marks over someone who even has experience from you if you're answering their questions the way they want you to. So that's great. And it's also given me some of the best friendships here that I've had as well. I mean, we really are a source to reckon with, with this network of friends we have. And I know a lot of us have helped each other through and gotten scholarships. And like me, I'll have my bachelor's in May and associates in December and no debt because of the people that I've met and able to help me with scholarships. So it really is a great network, more than just, being a scholar, but it's more of a family.
No.
Oh, it's just pre-recorded. Okay, that's
No, it is.
That's great. I think Hannah is on here also.
Hi guys. My name is Hannah. Reason why I chose AHEC, I come from LA, Southern California, and a lot of resources are very at every corner. So when my husband got stationed in the Coast Guard, we moved to Cape Charles, Virginia on the Eastern Shore. And let me tell you what a culture shock that was for me. I think there's one traffic light, there's no hospital, there's a little like a mom and pop pharmacy. I think Riverside, Eastern Shore is about 40 minutes up the road, or you can drive about an hour and 20 to Princess Anne and Virginia Beach, I believe. I can't remember, but I know it was a long drive, plus an $18 toll. I probably is more now, but anyway, being there, it really, and seeing the resources very minimal, and the transportation a lot of people didn't have. There's no bus route there. So seeing that and then seeing that and then living in LA, it was very, very different. And it got me thinking, because knowing that I did want to get and get into a program of nursing, it really shifted to serving the developed communities and things like that. So finding AHEC was like a great fit. I am in my second year in the ADM program at Rappahannock Community College. I have to say, the modules kind of scared me because it is 40 hours. However, you do have 2 years to complete it. So what I did is I did it during my winter breaks and my summer breaks. That way, when school was in session, I could just focus on school, and that worked for me. And you can work while you're doing your modules. You could do one little module and go and then come back. So it's very, very flexible. I know it says 40 hours, but you can make it work around your schedule and do a little bit here and there to complete it. So yeah, I think that's it. And I guess I will pass the baton to Hunter.
Hi, I'm Hunter. I'm also in the ADM program at Rappahannock Community College with Kendra and Hannah. And I'm in my second semester of the ADM program. And I'm from a really rural area and I've lived here my whole life. And I mean, there's nothing compared to like Richmond and places like that. And so I knew being a nurse, I needed to be like culturally diverse. And that's something I was never around and had never experienced living in such a small town. So that was part of the reason I chose AHEC, is because I knew that's something that was part of the modules and something that they helped you learn about. And so I've learned a lot about how to become more culturally diverse, and I feel a lot more confident about that going into my nursing career because I graduate in December as well with them. And that's something that I'm really grateful for AHEC because, like I said, from a small town, there's not a lot of different kind of people, and you don't learn a lot about people and the ways that different things can be. But that's something I was really grateful for AHEC for. And yeah.
That's great. Thank you so much. I think we have one more scholar from Southside, Sakithia Davis.
Hi, everyone. It's nice to meet everybody. My name is Sakithia Davis. I am representing the Southside region of AHEC. I am a student at Capella University, and I'm pursuing my bachelor's degree in psychology with a specialization in behavioral analysis. So this is my first year as an AHEC scholar, and I started during the summer. So I'm just getting my feet wet. But overall, I've had a really, really tremendous experience. So far, I think to me, one of the most beneficial things was the modules. They give you very real life knowledge and information that you can use to like apply back to your communities. Like you learn about stuff like chronic illnesses, so you're learning about blood pressure and COPD, stuff that you can use to benefit people, because it also shows you how to explain to people those issues and how they can better take care of themselves. And the modules are like really interactive, which I thought was really neat. So it's not like you're just sitting there listening, you're actually going to do scenarios and helping people out. So that was really, really nice. I don't have any like clinical hours built into my program since I'm doing psychology. So I've been doing a lot of the activities. So clinical like outreach activities. We've done a rapid revive, which is the opioid overdose training. We did it for the community, which was really nice. We did a blood drive. We've done a flu shot clinic. We have another flu shot clinic coming up next week. But I think the AHEC Scholars Program has opened so many doors for me to meet and network with so many different people and businesses that I hope to make longer lasting relationships with. So.
Thank you so much. Before we open up to questions, because I know probably people have questions they want to ask the scholars or questions they want to ask us, I did want to go over some information about how to apply, which I feel like is good information for you all. Let me over here. Are y'all seeing this?
Not yet.
Hang on 1 second. Oh. Okay. Okay, so and Abby is going to put the links in the chat, so don't freak out if you can't get them all written down. She's going to put them in the chat so you can definitely take them and copy them. But how do I apply? So you're going to complete an application using our form. You're going to submit a transcript. You can do that on the form, or you can email it to us at info@vhwda.org. And then you'll submit one letter of recommendation. And we do have a recommendation form you can send to your recommender to email back to us. And if you've got want to know more information or felt like, oh gosh, I know they said something and I can't remember and I had to leave, the website is here as well. And Abby will put that in the chat as well. Some dates to remember moving forward. Today's our scholar interest meeting. Congratulations, we're all here for this. Our application for a 2025 cohort, that's our next cohort that we're admitting, the deadline is January 6th to apply. That's a Friday. So make sure you get your applications in before that, because I know there's a nice break that happens around that time that maybe people that may be burned out think, oh, I'll do that later, and then they don't get to it. But just make sure you put that on your calendar so that you get all of your supplemental materials in on time. And then our decisions will be made about the week of January 15th, and our new cohort, our 2025 cohort, will start the last week of January, first week of February of 2024. So those are some key dates to remember. All right, I'm going to open it up for questions now. I'm also going to put the information, the contact information for our different AHECs on the screen. So if you want to put a question in the chat, Abby will read it for us, or if you want to unmute yourself and ask your question, we can do that as well. And this information is also available on our website.
Hello.
Hi.
Can I ask a question?
Sure.
Awesome. So my question was about, first of all, thank you all for coming out tonight. I really appreciate you having the interest meeting after hours. I know it's a long night, so I really appreciate it. I wanted to ask about the timeline after completing the scholarship program. So as my understanding, you apply, for example, if I'm graduating 2026, I would apply for the 2025 because that would be about 2 years before. And then afterwards, what if I want to pursue, for example, residency? Would I not be allowed to because I've pursued the AHEC scholarship?
No, not at all. This I'm guessing you're in medical school.
Dental.
Dental, okay. Yeah, so if you want to do a residency after your program, that's fine. Your graduation date's 2026, so you'd be eligible to apply for this coming next year, and we can keep you, on our interest list and invite you to some things coming up so that you remember us and you want to apply later. But it would be the year of the last part of 2024 into 2025, and then the whole year of 2026 that you would actually complete the program. Once you have completed the program, we just ask that you keep your information updated with us, your contact information, so that we can send you our year. It's a post AHEC scholar survey that we send out about a year out. And that's just asking questions like, where are you currently working, or where are you doing your residency? It's kind of helping us to evaluate the program and making sure that our students are maybe staying in those rural and underserved areas that we're training them to go to. So it actually should be more of a benefit for your residency applications, because you'll have some of these experiences that other students wouldn't necessarily have.
Okay, thank you for that. Just to clarify one point. So if I'm graduating 2026, I can still apply for the 2024 one that's coming in January, but that would make my course load between 2024 and 2025. And if I wait another year, it would be 2025 to 2026. I'd finish the course load. Yes.
Right.
Okay. Thank you.
And we've got a question in the chat from Dominique.
Mhm.
She asks, for our letters of recommendation, who do you recommend write our letter? I'm a PA student. Do you prefer our program director, faculty advisor, another faculty member, or a previous employer?
I think faculty would probably be the best for you. And if you don't have a faculty member, then go to your employer. But it's whoever you feel like would give you a good recommendation from the faculty that you're working with now. In some cases that might be the program director, in some cases that might be just another faculty member that you're closer with. So that's fine.
Are applications viewed for acceptance as they are submitted, or are they all reviewed after the January deadline?
I'm not going to speak for all the AHEC center directors, but I'm sure they're eager to get everyone's application and start reviewing those. I'll look for nods of yes. Okay. So I'm assuming they're going to review them as they come in, but the decisions won't go out until January. Other questions? Does anybody have questions for our scholars who are here tonight?
I had a question for applying to particular AHEC areas. When you apply for the AHEC Scholars Program, do you select where you go, or is it selected based on need?
So that's a really good question, and meant to cover that in the application part. So for your AHEC Scholars application, it's typically going to go off of what region your professional school is in. So if you're at VCOM, you're going to be in the Southwest. If you're if you're doing dental school here in Richmond, you would be in the capital area health education. But there should be, with a statewide program, there should be opportunities for you to go out to different parts of Virginia to get some of that clinical training. If you want to do a RAM clinic or other things like that, we can make those available to you as well. But I believe, and maybe the capital area, capital AHEC scholars might have some more insight on that. I'm
Yeah,
assuming.
so I was just gonna jump in real quick and say that there's definitely opportunities to do RAM clinic. That's, I think, one of the opportunities that Capital Area Health has like kind of routinely done, and they usually partner up with VCU to take out some medical students, as well as dental students. But I think the last couple of years, I think Howard Dental School has been present for most of the RAM clinics that we've attended, but that's still an opportunity and there's always a need. And then at least for the Capital Area Health location, there's also like a floating activity list with additional opportunities. So sometimes those opportunities will take you slightly outside of like the Cap AHEC region. But it really is based on like where there's a need and where people have reached out and expressed that they want like Cap AHEC to come out and help with events and like health fairs and things.
Thank you. I appreciate it.
Thank you, Susie.
And we have another question in the chat. How does the scholar program fit within a college schedule? Is it really flexible, or is it something that requires a summer commitment?
That's a great question. Also, so the scholar schedule is something that you will work with your AHEC center director or program staff to establish and make a plan for as you enter the program. So knowing what your individual course load is and what's going on, and knowing what our requirements and expectations are for the program, you'll work with your AHEC center director or staff to talk about, well, how am I going to get these 40 hours done? What does that look like for me individually? And when would I go into clinical rotations, and where am I going to go and do those clinical rotations? So that's something that's more individualized. It might be that you have to do it over the summer because your course load's really heavy in the spring, or it might be that you can get everything done before that. It just depends on what schedule you guys come up with. I don't know if any of the other scholars have had to kind of move around their schedules or think about when they were going to do things that might have some insight on this.
Yeah, I would say it's extremely flexible and more tailored to, how you want the program to run. I did all of my modules over the summertime that I had and just did a little bit each day. And then I do have clinicals within my program, and all of those hours were accepted. So that part was a little bit easier for me. But it really is just tailored to you. You have a full 2 years to get it done. So even if you can't find ways to fit clinical in while you're in semester, those breaks and things like that, 40 hours really, it all goes by really fast. So it's really tailored as long as you're able to work with whoever's advising you and just keep them up to date of where you're standing at. You can pretty much make your own schedule.
That's a good question. Other questions? Okay, if we don't have any.
Amy, just
Yeah,
a quick question. Did you want to talk to some of the prospective scholars about the didactic training and really what that entails and the certification that it makes them eligible for once they complete it? And you might have mentioned that.
So there are two different, I didn't want to confuse people by like
Yeah.
putting too many details in, but there are two different tracks you can do as an AHEC scholar with our didactics. Are individuals that are maybe in those associate's degree programs for health professions will automatically be placed into our community health worker training, which would make them eligible for a community health worker certification. Our applicants that are going to be in medical school or dental school or those other profession that were on that eligibility list prior to the community health worker and public health sector, they are going to do the traditional modules that I had gone over earlier. If they're interested in doing community health worker training and getting that certification on top of that, then we can switch that out. It's something that you'd have to work with your center director to make sure that you're enrolled in the modules that you want to be in. But regardless, it's 40 hours each year. It doesn't matter which ones you enroll into. They all do still cover the 8 core topic areas that are outlined by HRSA as well. So we're making sure we're hitting all of our grant initiatives and what we're supposed to be doing with that as well. So you'll see like our medical students from our capital AHEC, they've done the traditional modules and are completing year 2 of those this year. And then our students from Rappahannock and Southside, they were enrolled in our community health worker training modules and have completed or will be finishing those up within the next year.
Whatever medicine the rehab doctor put him on, he loved it. And I just got him a script for 120.
Yep, there we go. But I just have one more slide to go over with you all, and that is, of course, our social media. We are Virginia AHEC, and of course our centers all have their own social media as well, but we'd like you to engage with our Virginia AHEC Twitter, LinkedIn, Instagram, and Facebook pages. As you move forward, we'll be putting out information about workshops and things that were going on or different places to volunteer or things to do as the year goes on as well. So we hope that you'll be submitting an application soon, and we are really excited to work with you as the 2025 cohort coming in. So that is all I have for you all tonight. If you have other questions or you want to stay after, I can be available for a couple of minutes. But otherwise, have a great evening, and thanks so much for coming tonight.